So today, we're very excited to have Jos de Blok joining us today. He is the founder of Buurtzorg, a community nursing organization in the Netherlands that's changing the way that nursing is done. It's providing better outcomes for patients while at the same time cutting bureaucracy for nurses and letting nurses do what they want to do best, which is help people. The conversation will be led by Lucas Freitas, our resident storyteller at Semco Style. And if you come across any interesting insights during the conversation, please share them on social media with the hashtag WorkWise in Semco Style, and I will see you there. Without further ado, I'm going to hand it over to Lucas for us to get started. Lucas, over to you.
Good morning, Mariana. Good morning, everyone in the audience. Jos de Blok, good morning. You're joining us from Finland this evening. Very nice to have you with us. Thank you for sharing your time and journey with us, Jos. Would you greet our audience?
Yes, good evening, everybody from Finland. It's still very light here in Finland because we are celebrating Midsummer Party tomorrow. So I hope you enjoy the webinar.
Thank you very much, Jos, for joining us today. Buurtzorg, that could be translated as scarehood, is the fastest growing organization in Holland. The nonprofit went from one team of 4 nurses in 2007 to more than 10,000 people nowadays. Last Monday, Jos and Ricardo Semler had a conversation about management. They were speaking about this paradigm shift both Semco and Buurtzorg are a part of. One of the things Ricardo said, it really had stricken me. If you try to manage 10,000 nurses at the same time, you will need a lot of control. But if you work with 1,000 teams of 10 people, it is completely different. So Ricardo was talking about his experience of breaking a company or an organization into self-managed teams, a format very similar to how Buurtzorg operates. Mm-hmm. In an organization that chooses self-management, you're actually looking at small groups managing themselves and their interactions. That is how Buurtzorg and Semco tap into the vocation of people and save a lot in overhead. Jos, where did you draw inspiration for the people-centric changes you brought into Buurtzorg?
The main inspiration came from my own experience as working as a nurse. I worked for 15 years as a nurse in the 80s and beginning of the 90s. And in Holland, we had a very good community health nursing system where, as a nurse, you were responsible for all the care delivered in the neighborhoods, also for young children. And you were responsible for taking your own decisions every day. You took care for patients as good as possible. And you had colleagues, 6, 7, 8 colleagues, with whom you shared your experiences. And this was the way it worked in the 80s. And after that, we get big hierarchical organizations, so-called professional organizations. And I became manager for 10 years. And after these 10 years, I thought it would be better if we took the old principles with the new insights and new possibilities of IT to make a scalable model. And that's what we did in 2007.
I see. Jos, what is the cost of each new team on this fast growing? So you've been coming on a very steep growing curve. How much does it cost for each new team on Buurtzorg? And how long does it take for a new team to break even for the organization?
It's a bit different, but an average cost is around €25,000 when a new team starts. So it takes some months to have their patients, to build a network, and to be break even. But it's some teams already in the first month are break even, and some in the 4th or the 5th month. So the average is that it costs €20,000 to €25,000 per team.
I ask you this because of a consideration I read in Frederic Laloux's book, Reinventing Organization, where Buurtzorg is one of the case studies.
Mhm.
So what he says is that how Buurtzorg is growing this fast and within this neck-breaking speed, there are remarkable financial surplus. So the rationale is that with when the growth stalls and this big cost comes down, there will be a lot of funds to reinvest on the non-profit organization. And I'm very interested. Have you already made plans on which direction the organization wishes to steer, and where will you bring your self-management focus to?
Yeah. At first, we started with this community health nursing because, in my opinion, it had the most opportunities, and it was also the biggest problem in Holland. At the moment, we have startups with psychiatric care, with youth care. We're building pensions for people for staying for a short time and for rehabilitation and go back home afterwards. We are developing neighborhood clinics. We have an experiment. It's called Buurtzorg Living, and it's small groups of houses, so that people don't have to move to a nursing home, so they can stay in their neighborhoods. So the idea, the total idea for the future, is to build an infrastructure in the community where different services are delivered based on the same principles, and it gives the people in the neighborhood the opportunity to have all the services in health and healthcare in their own environment.
I see. But what I mean is, like, you probably will have a huge budget. I sense that you might go even further than that. Will you step into other areas of healthcare? What do you have in mind in there?
Yes, for example, this psychiatric care, mental care is another part that we are now experimenting for 2 years now. But these neighborhood clinics, in my perspective for the future, I think we don't need hospitals anymore. So I think the coming 5 to 10 years, we have to build alternatives for hospitals. And even now, I think we could do with 50% of the beds. So there can be a big reduction if the infrastructure in the community is more fit for solving the problems. So it will be different concepts. We are investing in these different concepts. We don't want to do it with investors. We want to do it with the money we earn from Buurtzorg, so that we can have our hands free and feel no pressure from shareholders.
Yeah, I take this movement of yours very kindly. I, in the past, had a very tough experience myself with not very personal healthcare. I felt very much like a number in the shelf. I had a wrong cancer diagnosis when I was 30. And actually, I'm very thankful for that disaster, because it made me steer my life on the direction I really wanted. But it was very scary the way things went. It was as if I was not a person, and the people I was relating to saw me as a box in a shelf. And it's very, it fills me with hope to see you steering such a beautiful movement in this direction. Going in this move, Jos, I believe Buurtzorg confronts a strong myth we all live under in modern days: the idea that only money moves the world. For most people, it is common sense that public or non-profit organizations are inefficient. The same goes for self-management. Everyone thinks it's impossible. Well, I think you're proving the contrary, and so does Semco. I dare say we live a purpose crisis. What are your views on this?
Yes. When, as I told about my own experience as a community nurse in the 80s, it was focusing very much on professionality, on intrinsic motivation, and on purpose. And after these years, between the 80s and now, you saw that it's more and more the focus is on control and command and on management and on money. And I think we have to go back to more purpose-led organizations where the intrinsic motivation of and the craftsmanship of professionals is in the lead. So what we have shown now is that it's much more efficient if if the workers can do what they think they should do, and if they organize it themselves. We have did several researches with KPMG, with Ernst & Young, and every research again shows that it's much more effective to do it this way. It's the solutions are better, the outcome for patients are better, the nurses are more motivated, they're more satisfied about their work, and the costs are much lower. So the outcome in cost for society is also much better. So I think, in general, I think we should move towards more purpose-oriented organizations.
Yeah, the results are out there. Eh? They are something that cannot be discussed. This is very strong. Jos, you have been traveling a lot lately and sharing Buurtzorg experience with many people. In your conversation with Ricardo on Monday, you both realized that you have a common interest in education. Mm-hmm. What are your projects heading in this direction?
My idea is that the idea on education should also be based on what people want to do. So I'm very critical about the current educational systems. For example, the Dutch Minister of Education asked me how she could adapt the principles of Buurtzorg in the educational system, and I would love to do some projects on that. I won't start a school, but I want to show that learning based on what you want to learn and using all kind of different ways of learning is much more effective than a very traditional, standardized way of teaching.
Yeah, I think it's about keeping it simple, isn't it?
Yes,
Jos, the query.
And also,
sorry, please.
Also, taking if it's a patient or a student, every time again, take this person as a starting point. Take the experiences, the skills, the interests as a starting point for doing things. Not starting with the programs or the protocols, but start with what does somebody want to learn and how can she learn throughout their lives. So that's also in healthcare an important issue, I think.
Having the focus away from the rules, that resonates with me too. Jos, the core ideas behind Buurtzorg are simple wisdom. Simple, though, is not always easy, is it? Why do you believe modern society struggles so much to keep it simple?
I think that if you look at the education on how to organize, or how to deal with business, or how to organize, it's based on ideas which are very complicated, I think. If you look at the average MBA study, it has a certain pattern in how you should organize. And what you see is that almost everybody who is leading an organization thinks that this is the only way. So we moved, I think, from different ideas about organizing towards only one standardized idea about how to manage things. We manage schools, we manage healthcare organizations, we even manage governments. And I think we should think about in what kind of context the services are delivered, what kind of way of organizing fits the best. And I think we should, as also Ricardo says, as a starting point, you should take the quality of life of people, and not focus on the processes and on the efficiency. If people feel that they're doing the right things, if they feel that they are doing meaningful work, and they go home happy at the end of the day, the results will be much better than when you organize based on a management paradigm, in my opinion.
Yeah, I really like when you say that we now have this only one way to do things. This is really old-fashioned, isn't it? And it gives no resilience to systems or ecosystems. It's like comparing a rainforest to a monoculture crop. In a rainforest, you have a variety of agents taking care of many different processes on a variety of different ways. So if one of the agents is not there, there are many others taking care of that same process on other ways. And this gives resilience to that ecosystem. But when you look to a monoculture crop, it is extremely fragile because there's only one agent taking care of a process. It's sucking up all of the resources, and it's highly dependent on external management. You need defensives and fertilizer, so it's just a not sustainable way. And I think we've been emulating the wrong metaphor. We should go for more organic solutions and not so mechanical ones. Jos, where did you first hear about Ricardo's work and Semco Style?
I think it was in 2009 or 2010 that this Dutch journalist, Ben Kuiken, he was writing a book about, it's called The Last Manager. And he interviewed me, and he also went to Semco, and he said, did you hear about this famous and amazing company in Brazil? And when I read about it, I thought it's funny to see how much we have in common, how the principles of Ricardo are quite the same principles as we are using in Holland. So I became more and more interested and read a lot about what he has been doing. So since then, it's been a very inspirational source for a lot of people in Holland, and also for our workers, to see that there are more people who think that this is a more human and more effective way to organize.
What really strikes me is that when different amazing people get to similar solutions, it is speaking of simple wisdom, isn't it? Like, it is all about people. The best way to lead is to lead by omission and let people grow. Treat people as adults, and they will behave like adults. Those are very common sense solutions. But still, it took us so long to get into that, isn't it?
Yes, it's amazing that so many people are doing it differently. So if you look at in Holland, we are still quite an exception. You see that it's getting mainstream now, that organizations are using more self-organizing principles. But I think for the first 5 years, everybody was waiting for the moment that Buurtzorg should collapse, because it was not possible without a formal management structure. So I said, yes, we'll wait and we'll see. But every year we got prizes for everything, for the best employer. We get the fastest growing company. We had good results with patients. The most important thing, of course. So and these scores were significant better than the rest of the industry, of the sector. So and at the end, now after 10 years, we're celebrating this year our 10th anniversary. So we have a big party in September, and it's very important. We celebrate a lot. I think we should celebrate more, So every achievement by a team, even if it's by a small team, they should celebrate what they're achieved. It's their achievement, and that makes that they feel the owner of what they're doing. So yes, I'm wondering why not much more organizations are just stepping over to these kind of ideas.
Yeah, I feel you're making a very good case example of moving out of this mindset of scarcity into one of abundance, isn't it? Like there is enough for everyone if we use it wisely. And I might be wrong, but I feel a tectonic movement in this direction. I recently read this report by McKinsey that the number of executives that foresee social unrest in the future has skyrocketed. And yeah, we all know what's wrong out there. It's just that most of us are not doing anything about it. And when I see people like you and Ricardo taking the lead, that does fills me with hope.
Yes, I think if I look at Holland, and also I've been working the last few years with 40 different countries, like in Asia, Scandinavia, US, Canada, Australia. And you see the agile movement, you see the teal movement, you see Semco style, and it's all about the same things, I think. So it's all about focusing more on purpose, on human ways of doing things, and I think it's becoming more and more normal to think this way. And we also, I think, we almost feel that the current solutions are not solutions anymore, are more creating problems. So I think the coming 10 to 15 years, we see more and more of these principles in a lot of industries and sectors. At least I hope we will.
One of the things that really inspire me is that at Buurtzorg, as well as in Semco, the methods were developed by makers, not by managers. It was people on the shop floor, people sitting there with the elders and people sick, that developed the methods. It's not something coming out of the academia or a consultant, and that really strikes me as effective.
Mm-hmm. Yes, I think that's what I taught is, and what I learned as a nurse. If the things you're doing every day are logic for you and are very practical, then it's self-steering principles are very logic. So if you focus on the routine and the continuity, then you don't need to manage, you don't need to control, because everybody is doing the right things. And then you only need to have a few guidelines. Everybody understands that it's necessary that the money what comes in has to be more than the money what goes out. So every team knows what the result must be to be break even, to be cost effective. So, and we don't discuss it so much. Just once a year, we say if we have a productivity, for example, for 60%, then we're doing okay. And the average, the last 7-8 years, has been every year exactly 60%. So just by mentioning this figure, everybody feels responsible for being on that level.
Yeah, on a much tinier scale, I had an experience co-founding a nonprofit with 8 families in Brazil. We started a communitarian school, and with very little experience on horizontal management, we had a very steep learning curve. And I think that the biggest pain point I can remember was decision making. It took us a while to reduce the need of consensus to a bare minimum and agree on boundaries and mandates to get things done. How is your experience with decision making on Buurtzorg, Jos?
This was in the first years. It was something we developed together, also with the nurses and some friends who had a lot of experience in coaching. And what we saw about that, all the teams had the same patterns. They all had to learn the same things and had to deal with the same obstacles. So we said we want to focus on consensus. So we want that teams decide based on consensus. And every more or less obstacle, we wrote an article about it on our web. So that every team could see, oh, this can be solved in this way, or this can be solved in that way. And then we developed books based on these articles, so that when a team faced some kind of a problem, they could find in this book or on the web, oh, you can handle it this way. But it was necessary for every team to learn how to deal with these different obstacles, and what you see within a few years is that it's not a problem anymore. And when they look back, they see, oh, we learned how to deal with everything, and now we are a more mature team. So it's part of a learning curve, I think, and most problems can be solved by teams. And when they're struggling with it, they can ask the coach. They can ask a coach to support them, and then you get some advice, some support when it's needed.
Yeah, it's when I hear you talking, what really strikes me is that Buurtzorg really understands that knowledge sits on people. It's not something detached from people, and that it is by connecting people that the knowledge flows. Jos, Mariana is sending us the first questions from the audience. Shall we hear what people have to ask you? So our first question comes from the United States, from Joris. Joris wants to know, how do your teams coordinate work among themselves?
These teams, they see each other almost every day. So nurses know each other. They hire each other, and they discuss how much they need to see each other to coordinate everything. Usually, there is one in a team who is responsible for taking in new patients, so doing the assessment and doing the intake, and then she decides what's necessary to do to schedule the activities. And then usually every Thursday they are sitting together and discussing what's needed to change, so that every patient is supported in the right way. But everybody can at any time on their iPads change things. So everybody is responsible for a certain group of patients, and everybody can change things. Usually when there is a acute something, for example with a patient who's terminally ill, they just phone each other, or they send an SMS text, or they put a report in the file on the tablet. So there are many ways they are coordinating. There are no rules about that. The idea is just
managers. Instead, they are coaches. What is the difference between those two roles?
I always said for a joke that managers who don't need to coach for a year. They just have a cup of coffee and then say, oh, okay, we will ask you when we need you. Sometimes teams are going through a difficult period. Sometimes they have some nurses who are ill or sick for a longer period, and they're struggling with their scheduling, for example, and also to support their colleagues. So then the coach comes in, and the coach sometimes takes over the guidance of the nurses who are ill, or giving advice on how to solve a certain conflict between nurses. But they're only there, the coaches, when they're needed, and they're not there when they're not needed.
Yeah, I remember you mentioning that certain teams on the beginning of Buurtzorg had much more support, and that until today they are not as independent as the teams who did not have it.
Yes,
we have another question. Oh, sorry. Please.
I remember that, when in general, I think, and that's also what you see with managers, they are much too careful. They think that people can't solve their own problems. And I say, but if you look at what people are solving at home and how they are dealing every day with quite difficult issues in their private lives, why couldn't they solve small problems at work? So I think we shouldn't be too careful and just let the nurses themselves, let the workers themselves decide when they need support, not pushing it.
Yeah, I feel very much the same. We have another good question here. The culture that you have today in Buurtzorg, was it established from the beginning, or was there any tipping point to it?
No, we took quite a long time to think about how we could create a culture from the beginning. So we, together with some friends and also together with my wife, we took, I think, 1.5 to 2 years to design all these things we think were necessary to create what we have now. So we started with I think the same principles as we have still now. So the culture didn't really change. I think we wanted to have entrepreneurial nurses who were deciding on everything they saw in their daily work, who feel the ownership of their team, who were innovative, who came with ideas, and that's from the start. And I think we were lucky that we had a lot of wonderful role models. These experienced nurses who had a lot of experience and were 50 plus, gave a lot of examples for the young nurses. So that's
with such a distributed workplace, how do you spread the culture with so many big teams? I know you have online tools and stuff, but do you gather the team together on retreats? How do you instill the culture for everyone?
Yes, it's a combination. I think when you are a nurse, you have certain values. So these values are quite the same all over the country and all over the world, I can say. And if you look at the way nurses are experiencing about their colleagues, for example, the web, when we started, we created our own kind of Facebook. We said we want a place where people are sharing their experience. So if this team in Amsterdam finds a way to deal with problems of patients which is interested for other teams, then they should put it on this web. And that's what happened, was that a lot of teams are sharing their ideas, are asking for questions to other teams. We have an expert network, so they can ask experts somewhere else in the country for a special issue. For example, when it's about Parkinson, we have Parkinson nurses who have more knowledge about Parkinson. So there are different ways. We also have a lot of opportunities that they can meet each other. We have every year, we have 5 days of conferences, and then 3,000 nurses from all over the country are joining on different places in the country. And they can organize themselves, of course, meetings on the city level. For example, in Amsterdam, they have every month a meeting with representatives of all the teams in Amsterdam. So then they discuss their ideas about how to deal with the communication with the hospitals or the doctors in Amsterdam. But they can decide themselves on how to deal with it. And in a big city, it's a bit different than in a small village.
Yeah, I find that you are on a very special place where the culture is already very natural to the people, and that helps. We have a third question coming from Rome in Italy. The question comes from Andrea. How did the ideal size of teams, around 10 and 12, and the number of patients managed, 40 to 50, get quantified? Was it an evolutionary process or some sort of an upfront design based on data that you had at your disposal?
No, I think it was, my idea was very logical that when you have teams who are bigger than 10, 12, that you get coordination problems. So it becomes more and more difficult to get consensus. It's more difficult to coordinate. So my idea was that in history, you can see that 8, 10, 12 is also what Ricardo says. 8 and 12 groups of people works the best way. And I always say also it's difficult to find bigger tables than for 10 to 12 people. So we say the office and the table should be big enough to have everybody around it. So 10, 12 persons is, but it was when we started, we said that's the maximum 10, 12, because my experience was that when it's bigger, it creates more problems.
Good. We have another question coming from Jamie. Jamie wants to know what were the biggest obstacles you faced as an individual and as a team?
For me as a person, the biggest obstacles were more in the outside world. So in healthcare, you are depending on the health insurers in Holland. So they were not used to such fast-growing organizations. So every year again, we had this discussions about are they going to pay or not. So we were helping patients, and throughout the years, a lot of what we did wasn't paid for. So I think it was around between 25 or 30 million we delivered services, care, and there was not paid for. So that was, and in the beginning, when we didn't have so much fundings yet, that was quite a risk. So I had to negotiate all the time with these health insurers. So for me, that was one of the biggest obstacles. For us as a team, I think we didn't have really big problems or obstacles. The team which started this, we were all friends. We still are. And I think being friends is better than being a management team. So it gives a lot of more trust-based way of working together. So and then I always find it very difficult to mention a lot of problems or obstacles. Of course, we had some, but not really very big problems, I think.
Yeah, they were dealt with. Our next question is related to this one. The question comes from Michaela, and she wants to know, how has the collaboration with general practitioners been? She's wondering how medical doctors cope with the self-organizing system.
Yes, from the start, we said that the general practitioners should be our biggest ally. So we said we need to collaborate with them. And we were sure that if we were doing the right things, they would like to work together with us. So, and they're very happy with these self-organizing teams because now they have the phone numbers of their nurse. So they say, I only have to phone this mobile number from my nurse, and it's very personal again. So they build very informal networks with these GPs. And when you have this patient who is terminally ill, and in the evening you want to discuss the pain medication, it's very when there is a trustful relation between this nurse and the doctor, they just phone each other, or they send a text message and say, okay, we know that things are going right. So communication, information, and a trustful relation comes together. Then things, continuity is there. The feeling for the patient that there is the right focus on support. So everything depends on trustful relations, in my opinion, if it's about good quality of care. And so the GPs are our friends, I can say.
Yeah, I can clearly see the influence that Buurtzorg is bringing to the doctors. How about the families and the patients themselves? So is self-management pouring into them too?
Yeah, yes, I think that's the starting point, was also that we should work from out of a vision that we want to support people so they can develop themselves as much as possible and as long as possible. So we focus on self-management of the patient and the families. So we say if we involve the families and if we involve the networks, then people become more independent. In healthcare, it always sounds very positive, but you can also become very depending on the healthcare system. And what we say is, no, we want to have people supported in a way that can have a normal life as possible. So when you have these handicaps, when you have these diseases, you still want to have a normal life, and you don't want to be disturbed by the medical system all the time. So I think we have to follow the path of the families. We have to follow the lives of the people we are serving, and from a perspective that we must do as much as possible to keep people there, let people have their own lives as long as possible.
The next question we have arriving here is from someone that has been around Buurtzorg. The question is from Joe. She's saying that she was lucky to be on a course with a Buurtzorg member. And one of the challenges that this person felt was that one of the members was surfing along on the hard work of another member. And people were scared to confront that person with her behavior. Mm-hmm. Is there a sort of mediation team that deals with this kind of situation?
Yes, usually these things, of course, happen in teams. These things happen everywhere, I think, when people work together. Usually, these problems don't stay very long because other colleagues see what's happening and they don't accept it. Another important role of the coach is to see these kind of things and to discuss it with the team if it's disturbing the atmosphere in the team. So usually we say every team meeting should start with the question: how does everybody feel today? How is everybody feeling about the collaboration in the team? Are there hierarchies in a team which are not so clear, but are influencing the decision making, for example? And of course, it will happen all the time that these things are there. But we try to create an open culture in the team that everybody can say what their feelings are about the way they're working together.
Yeah, very good. We have another question coming over for you from Christine. Christine wants to know, how do you manage medical practice from a legal perspective?
And and then I should ask, what exactly does he mean? But from a legal, in Holland we have the inspection, the health inspection, and we were lucky that just a few weeks ago they did an audit. So they visited several teams, they visited several patients, they looked at all the materials we are using, and we had the highest scores on everything. So they were surprised that in this self-organizing organization, everybody was supported so good. I think everything we need, and you look at the protocol side or everything, the legal aspects are done by the back office. So that's no problem for the teams. The most important thing for the teams is that they can find everything on the moment they need it, and then it's all on the tablets they are using and on the learning environment. They can learn in the evening when they're sitting on the couch and think, okay, perhaps I need to some more practice about diabetes. Let's learn about again. Then they can do that. So we didn't have any legal problem from the beginning and till now.
Oh, that's very good. Jos, which are the relevant metrics when it comes to healthcare?
I think it's most important thing is do we solve problems of patients? So when we started, the most important metric was counting hours and minutes. How much time are we spending for what kind of patient? I think that we should focus on what are the problems patients are meeting, what are we doing about it, and what are the results. So we focused and we also changed the system in Holland to a more outcome-based way of working. So we introduced the Omaha system. It's a classification system of problems, interventions, and outcome. And now the whole country is using the Omaha system, and the focus of nurses changed from production towards useful interventions. So I think the outcome, does an intervention has a good result? Is the patient satisfied? Is for example, a patient with diabetes, it's important that they know what diabetes is about and what the consequences are, and that they can live in a way that they can have a normal life with this diabetes. So we have to focus on learning how to live with diabetes, and then ask the patients, did we succeed in doing that?
Clarity of what the problem is, clarity of purpose, and how to address it. Yeah, that is beautiful. Jos, we are getting to the end of our hour. Thank you very much for staying up this late with us. It is a pleasure to learn from your experience. Would you say your farewell to the people watching us today?
Yes. Goodbye, everybody. Thank you for listening. I hope it was interesting, and have a nice day.
Thank you again, Jos. A pleasure to meet you.
Thank you, Lucas.
It is very special to be a part of this project. I want to thank you all in the audience for sharing your time and questions with us. Mariana, thank you very much. How did you like our chat today?
It was very inspirational, and I learned a lot, and we all had really great questions. Unfortunately, there was just such great questions that we weren't able to get to all of them this time, but thank you so much for sharing them anyway. We will hopefully be able to get to them in the future and inform what the future work that we will do for you as well. Thanks for joining us. I'm going to ask one of my colleagues and I'm going to do this right now as well, to put the link to a survey that you in the chat. If you can go, my colleague Ian just posted the link to the survey in the chat. If you have 5 minutes before you leave, it takes 5 minutes and it really helps us bring you better content. So please take 5 minutes and write and tell us what you thought in the survey about the discussion. Also, I posted a couple of times about joining our LinkedIn community. It's growing. We're having amazing discussions on there. This is the best place for you to connect with us. Also, you can connect with us through the hashtags Workwise and Semco Style on social media. Tomorrow we are going to send a link with a recording of our conversation, and you will be able to access it then. And so look forward to that. And thank you so much. It's been a pleasure being in the chat with you all, and reading your wonderful questions and interacting with you. We will have a discussion, another Semco Style Chat next week. So look forward for more information on that early next week. So thank you so much for joining us, and I hope you have a wonderful rest of the day wherever in the world you are. Thank you.